Welcome to the very first episode of PANCE Rx. I am Jade.
And I am Autumn.
And we're just gonna, I guess, get this show on the road. Autumn, we're
Right.
here. Like, months and months of planning.
Stressing, planning, IT, tech.
We just had some issues like 2 seconds ago, bro. Like,
Literally.
would it be anything that we do without issues like that?
No.
I mean, I was class IT technician. I mean,
You were, and I was chief of side hustle operations. So I'm an IT tech on the side.
On the side, just a little bit. So,
yeah.
This first episode is really just like intro. Like we, want you guys to get to know us, like what we do, what we're about, like why we're doing this. Get a little taste of the prescription, if you will.
Yes, just a little teach.
So I guess Autumn, we'll start with you. You just started an ED residency.
I sure did. Can't you tell my eyes? I'm tired.
So how is that? Like, give us an update.
So honestly, I love it. The scariest part, honestly, was moving away. I'm not close to anyone that I know, but I think that that's good because all I have to do is focus on work and my classes right now. So my schedule's actually pretty cool. It's 3/12s one week and then 3/12s and an 8 the next week. So I get 40 hours of pay period. I'm compensated pretty well to be a residency program compared to other residencies across the nation. I'm working full-time in the ED. I have didactics that I'm responsible for. There's a schedule. I just have to hit the classes as they come. And my boss checks them off for me. And then I have to do a didactic presentation to all of the other residents in my residency program, I guess you can say, and all of their supervising physicians. So I'm looking forward to that. And I'm just learning every day. Like, it has been a great transition leading in. The physicians that I'm working with are so helpful. They know that I'm in a residency program. They don't expect me to be a new grad coming straight in, knowing everything. And I feel so comfortable asking them questions.
Cool.
So it's starting off very well.
I love that. I love that.
Tell me about your job.
Big ortho PAC, I deal with the bones. I think it's crazy. I'm actually mostly surgical. So I have a pretty sweet schedule too. Like I work 5 days a week, 2 days off, like on the weekends, like no weekends, no nights. Pretty cool. My schedule really depends on the surgeries. So like next week, if I have a joint day, I'll have like 5 joints and I won't get out till like 5 p.m. But if I want a hand surgeon, because I'm not with just one doc, like I don't have one SP, I have multiple SPs. And so when, like if I'm with like the hand surgeon that day, I'm done by 10 a.m. I go in at 7, done by 10, I can go by my day. I can hit Trader Joe's if I want. Like,
I'm jealous.
So it's been pretty good. Like I'm excited. The transition actually is a lot different than yours because you're kind of going from like student to kind of student then to full PAC mode, whereas I went from student to PAC. And so being a new grad, like there's a lot of like imposter syndrome and you're kind of doing a lot of self-learning. Do I regret not doing a residency? No, but I wouldn't have, if I would have went a residency, I wouldn't have regretted that either. Like either way, I feel okay about my decisions.
I think that comes along with the nature of the specialty. So ortho is, once you get it, you got it.
Yeah.
All you have to do is, see it a few times, get walked through it a few times, and then you're doing it. Whereas ED, every day is different. Nothing is planned. Think about when COVID came on. No one knew what that was in the ED. You just had to adapt and work through it. So I think just having that extra training behind my belt is going to help in the future. And then also my schedule is cut and dry. Like you're in at 8, you're out at 8. You're not staying after seeing extra patients. You leave and you hand off to the next physician. Yeah. So I think that's a huge difference between both of our specialties.
Yeah, but I think for what we're about to do with this podcast, I think it's good to have a hospitalist perspective, private practice, and then the ED. Like you're gonna bring a lot of like the zebras, if you will, to it, and then even though even though I'm specifically in ortho, with surgery, you still have to deal with cardiac. You still have to deal with, endocrine. You still have to deal with all those things because you have to check their medication. If a patient comes in and they just had a STEMI 5-6 months ago, are they going to be cleared to get their surgery? So we still have to incorporate all of the specialties, even though I'm only in that one specialty. So I think that's pretty cool,
Yes, it is a collaboration. We can't think siloed because it is one big conglomerate working together.
Conglomerate. So, that's a big word. I love the vocab.
That's a Mark Wheeler word.
Oh, and what's that shirt you're wearing?
Oh, talk about merch. This is our PANCE Rx t-shirt.
Yes.
This is when I just had to rep the set real quick. So this is your prescription to passing your pants.
Exactly. So basically that's a little bit about us. We kind of started this podcast to bring fresh faces to like the podcast studying world. We all know the ones that we usually use. I won't name drop, but we have those ones, and those have been around for a long time. So it's time to bring some fresh faces there. I mean, I'm young, you're young. I mean, I'll be 27 tomorrow, y'all. Like, so I think it's time to bring some fresh, like, new aura, if you will.
Diverse.
Exactly.
Women. I mean, there's a lot of women podcasters, but I don't know. Most of the ones in the medical field are men. Yeah. Well, at least in the PA world. So.
But that's also, if you think about statistics, just of like African Americans, there's only 3.3% of us. And out of that 3.3% of us, women make up a very small population. Like, for example, in my clinic, there's only 2 Black women PAs. That's it. And that's a lot, for the field, which we want to, like, for future PAs and future, like, PA students and pre-PAs, we want to show you guys that this is, you can do this. You can be, you can be us. As long as you try, you work hard, and we want to help you get there.
Yep. Guess how many Black providers are in the ED with me?
So I'll go with let's go. I'm gonna say let's say 3 or 4.
You're actually hilarious. I'm the only one.
Really? Just the only one?
Yeah, and I met most of them at a meet and greet the other day.
Yeah. Okay. Well, but you're bringing that fresh face, and you're bringing that diversity. And yes, you're the only one, but now that we are doing this and people see that you're doing it, maybe you'll have another resident come in next year who looks like you.
Yep. And what I told them in my interview, I'm like, I want to bring diversity to your program. And I saw their light bulbs literally flicker.
I love that. So
you always got to kill them with kindness with that line in your interview. Just write that down.
Okay, gonna write that down. But so yes, that is the point of this podcast, to bring diversity, bring fresh faces, what you can expect from us, mnemonics. She's the queen of mnemonics over there.
I don't know why you're talking. You're literally the queen of mnemonics.
So mnemonics, just like funny stories things that stick, because I know I learn better when I have a funny story behind it. You got to tell them about the guy that got bit by a squirrel. That's a good one.
Oh yeah. They'll never forget that. They'll
never forget that. So just things to help you remember your information for your PANCE, for your EORs, for your test in school, and didactic. That's basically the plan, to make it engaging, to make it fun, to make it relatable, tell stories, but give you the content that you need. We plan on doing daily, questions. We plan on doing some farm, because I know a lot of the podcasts that we, use in PA school now, they focus a lot on the disease processes, but a lot of them don't have farm. You got to go searching for farm. So we want to include farm.
Now, PANCE, don't play about farm.
No.
Okay.
There's gonna be medications on there that you are like, I've never heard of this medication a day in my life, and you just got to use context clues. You have to use your better judgment. And so we want to help prepare you for that. Anything else that you can think of that I missed?
Well, also, we want this to be an open dialogue as well. So you will be able to message us, DM us questions that you have, and we will answer them for you. We will do a stat video for you on a topic if you need it. It's not super scripted and rehearsed like a lot of the other podcasts you see. Like, we want to be relatable. We want to be a resource at your fingertips. So please utilize us. Like, we're doing this out of the kindness of our hearts. We're both super busy, but we want to bridge that gap that we had to fill on our own.
Absolutely. And we plan to incorporate real world examples. So if something comes in, if I have a surgery one day and I'm like, oh my gosh, like this is perfect, we'll record an episode literally that day and be like, this is the patho, this is the mechanism action of the drug or whatever the case may be. This is the diagnosis, this is how you treat. As like a quick script, if you will. Just incorporating real world examples because I think it sticks better when it's not straight from a textbook.
Yes, I agree. Even with studying for my PANCE, the further I got away from clinical practice and rotations, the harder it got to remember things. So with us giving you clinical scenarios like storytelling, not just, you know, reading a UWorld question, hopefully you'll be able to remember those key features from these clinical cases that we give or stories we tell.
Yeah. So that's basically us. That's PANCE Rx. That's Autumn. That's Jade. We plan on dropping our very first like actual episode sometime in the near future. So if you guys have any topics you want us to start with, any questions you want to ask, anything, send us a DM, send us an email. It's all on the Instagram. Even if you click the link on the YouTube at the bottom of the screen, I'm gonna try to put it up there. You know, IT tech. You know what I'm saying? I'm gonna try to put up there. Send us, your questions, your topics, things that you're struggling with right now, and then we make our content like real in real time. So whatever you send us, we'll start with those things first.
For sure. Yes, we're always open. So please shoot us a DM, follow us on Instagram, YouTube, and we look forward to serving you.
All right.
Your
well, yeah, we got to give you your daily dose, your vitamins, if you will. Well,
all right.
It for PANCE Rx episode 1.
All righty. Bye.